con. See, in the EHR side, the appointments show up here also. So, and it looks like somebody has checked in this Constantine. So we can actually use that one, because I want to show the appropriate way to access the patient.
So this is the primary care.
Right.
And we use technology.
And before I do that, there's a couple of things that we typically make sure that we have set up in the tools preferences. And one of them is to make sure that this billable encounters filter is set so we can see the encounter that gets created. The other is to make sure that you have the correct location and provider, and that we have the correct templates to start from here. So that's why I want to make sure if we're going to do the ophthalmology that we have the correct launching point over here to be able to go to that starting point.
Okay.
Okay? So on the EPM side, when the patient presents and they check them in, so it looks like this Constantine has been checked in.
No, you are showing the primary care. Why not use the ophthalmology one? The eye doctor.
Okay.
Let's change to the results to. That's not.
I'm sorry, I can hear you because there's a lot of noise in the background.
Yes. Yeah,
I'm sorry, what did you say? Yeah, I couldn't hear what you said.
No, I mean, this column is for the eye doctor option.
So you want me to use this one?
Yes.
Yes.
All right. So notice how it says check-in, create encounter? This is what creates the billable encounter for the EHR side. So when you come in and your front desk checks this in, he doesn't have any information in here.
No, it's all right. We know about this now. Go on.
Right, but I can't check him in without this information.
Okay.
It's required. I'm just going to put something in here. And when you're training your users, you definitely want to check in patients so they can access it from the correct place. What's the zip code?
11203.
Okay. All right, we'll tab that. All right, so we'll just okay that. And it's going to take me through, hopefully, make sure that, okay, now we can do check-in, create encounter. All right, so we'll do okay. Okay, so why is it not giving us the encounter? Is this patient as a patient already, or just a, do I need to create the chart?
Can we get the chart for today? We have clinic today. Can we get the chart, the appointment list for today?
Right. But I'm just going to, you have some required fields in here?
Yes, let's get the appointment list for today.
Right.
Because we have more than 40 clients there. So if we can get from the beginning and get the appointment list for today.
I'm just going to do this. It'll just take a second here.
Okay.
And there's no rendering. Okay, so you have to put a rendering on there. All right. All right, so now the patient, now we have the auto flow. So they check the patient in, and they put an insurance on the patient, collect the copay, and I guess this is where you put your default rendering?
Yes, that's it.
Okay, so who's going to be the default rendering on here?
It's not there, Dr. Kodadadian.
Okay, but if he's not in here, I can't put one in, right? So I think we're using this Dr.
Yeah, I think we just use any doctor for training purpose.
Okay.
Okay, thank you.
We'll just go through there. going to close out of that. I'm not sure if it's printing that or not. Go ahead and close out of the fee ticket. All right, now, if I toggle back to the EHR, let me close out of this. And I'm going to go to my inbox, and we had is the eye one in here? Here's the eye doctor. There you go. So you can filter the resource that you're going to see in here. And one of the things that we train is the 4-point check to make sure that we have the correct doctor in here. So is our doctor listed in here? He's not. All right. So we'll just go ahead and use what? Which doctor can I use? This Jack Kelvin. Is that all right?
Okay. But that again, because we can't put our own doctor now.
Yeah, because that's a test DB. We don't have.
Yeah, we don't have. I can't use a doctor that's not in here. So which doctor should I use?
Okay.
So which doctor?
You can use Dr. maybe Dorfman something, Roberts. Dorfman. Yeah,
this one?
Yes.
Okay. All right, so we'll also want to make sure that on the encounter that we have Dorfman on here because he wasn't placed on there because I didn't know which provider to use. So I want to make sure that we have the rendering here as Dorfman also.
Okay, hold on. That one you put now, our doctor is there.
I'm sorry, I can't understand what you're saying.
The list you open now, Dr. Kadadada's name is there. The eye doctor.
I'm sorry, I still didn't understand what you were saying.
You open the list of doctors now, and I saw the eye doctor's name there. Yes, he's there, Dr. Kadadadi and Daniel.
Right, but that's not going to match the doctor on the drop down up here because you're not active up here. This needs to match the doctor.
Go ahead.
This needs to match the doctor that's up there.
Go ahead.
So, and I'm going to come down here and refresh that so that the doctor shows up. Because we have what we call a 4-point check to make sure that you match the location and the provider that you're working with and that the provider matches the provider on the encounter. So once they get you in the drop down, then those can match.
Okay.
And then I'm going to go ahead and I'm going to close out of the patient and we'll come back in from the inbox the way we need to. All right, when the patient presents and it changes the status from booked to kept when they get checked in. So your technicians are going to come in here and they're going to right click and they're going to go to the patient's chart because the kept tells them that the patient has actually presented. So what will happen is they'll right click and they'll go to the patient's chart and it shows them the action that gets created when the patient checked in.
Yes.
All right, so what will happen then is that the user will come to the template icon and we'll select the home OPH because that is the starting point for the ophthalmology.
So you come to the custom and click on it.
No, not the custom. The reason I did that was to refresh the window because I already had the patient up.
Okay.
You come to this little template icon here, or it's the one that's up here. It depends on where you put it.
Yes.
All right, and then here's your starting point for
You click on the one on top.
That's the same as this one down here.
Okay.
It depends on where you want them. Some people like them down here. Some people put the little icons up here. But it's the one that is the little templates icon.
Okay.
So on your user, if you prefer to have it up here, they can put it up here. If you want to keep it down here, they can keep it down here.
Okay.
It's the same icon, but it's the templates icon.
All right.
All right? So that will give you your preferred list. And in your preferred list, we want to make sure that we have the home-OPH because that's the starting point for the ophthalmology. then I'm going to click OK. All right, now, location provider, the patient's up here, the patient's name is here, and the data service is reflected over here on the history toolbar, so that's the same date, and it matches the appointment time. So the technician typically starts here and reviews information, because if the patient had been in before, any return to clinic information or follow-up information will be in here. Okay? If the PCP was not on the patient already, the user can come into this little patient providers link and set the PCP and or the referring physician, because you may want to be sending letters to them. But if you set it on the chart level, who their PCP is, it would show up in here, but this does allow us to come in here and pick a PCP also. So it's a list of all your doctors. There's also advanced directives in here that you can document. If the patient had been in before, the information would display here. This is where the technician can also confirm whether or not they wear contacts, glasses, and typically once they room them, they come to this left navigation and go to the patient tracking and indicate what room that the patient is in. Now, if you need help adding to these rooms or modifying some of the ophthalmology practices have put like a dilation room or a contact lens room or a visual field room in here.
Yeah.
We can help you adjust the list that's in here. That's not a template change, it's a DB pick list change. So I'm just going to put them in exam room 2. And you also have the option to change the status. And we can also help you add to this one. A lot of practices will put with technician instead of with nursing, because you mainly have technician. So we can also help you add to this list. That's also another database pick list change. It's not a template change. So we can help you do that.
Sorry, excuse me, Claire. So where to change that? Use file maintenance or?
I'm sorry, say one more time?
I mean, so where to change that if we want to make?
Oh, where do we change that?
Yeah.
Okay, let me go ahead and I'm going to cancel out of there. There is a system practice template. And in this system practice template, so I went under the file, drop down, and system practice template. And on the system tab, I'm going to click the show all. And there is this NGKBM custom DB pick list. This is the one that's used to adjust the appointment room, the appointment status. There's also one in here for the ophthalmology assessments. So I'll show you where those two items are. So in this NGKBM custom DB pick list, here is the appointment room. And when I click on that filter, it's going to adjust the center page here, or the center grid. And here is the list of items that were in there. And what I did was I just clicked on the column header of list name to sort it in alphabetical order. So if you needed to add something like a dilation room, what you would do is come to this add new list item. And let me go ahead and let you know first off right now that this particular one right here, you need to do it in production. You cannot export this from one database to the other. So if I needed to add maybe a dilation room or a contact lens room, I'm going to click on this add new list item. And this is the pick list that I want to add to the appointment room, which deposits that here. And the only thing I need to add is the list item. There's no qualifiers. So here's where I could come in and put dilation room. And I could add that. So it adds that to my list. Same thing with exam rooms. You would come in and add new list item, and put an exam room number in there as well. So I'm going to go ahead and save that one.
So if I want to delete one item?
If you needed to delete an item out of here, it's the same with each one of them. Let's say you don't have an x-ray room, you hit the delete. But in this case, if you want to modify that one since it's in there and change it to something else, like a visual field room, you could just update that one and change it right there. So if you don't have a lab, you can change that to something else and then you can add additional ones. Does that make sense?
Yes. Yes.
Okay. Now, let's go to the other one because we don't have the appointment status of with technician. So I'm going to change the filter here. And that's going to bring us down here, but we have a with nursing. Now, if you need this for other specialties, then in this practice, then you probably want to do an add new one. And we're going to go to the appointment status, and I'm going to click the OK. So it puts the appointment status in here, and again, I have no qualifiers that I need to put in. So I'm just going to the list item, and we'll put with technician in here. And I'm going to add that one. So that's how easy it is to add something to the list. I'm going to do the save and close.
Okay.
And now when I come into the navigation here and go to the tracking, and I come to the room, notice how I have a VF and I have a dilation room? I'm still going to just go ahead and put them in exam room 2 for right now. And notice how my status now I have with technician. And then when I do the save and close, it's going to keep track of that information. But also in the inbox, what it's done is it's updated the information here and the status. So any user that logs in here and has the eye doctor ophthalmology as the resource will be able to see that the Johnny Walker is in exam room 2 with the technician. Okay, you also have the option to come into the little button that's right here next to the appointments, and I can come to my preferences, and I can also come in here and change this to say with technician. And if I want to change that to a different color, that it'll change it to that color. So that's an option that you have as well. That option is a permission and system admin that you only want to give to admin level users. You don't want the average user to be able to change that. Alright, so then the technician will go through, review the information in here on the home page. There's also a place for alerts in here. So you can come in here and put no refraction, allergic to fluoresce. You can put a note in here and type a note. So you can free type in here. And when you put an alert in there, it changes to red. So each of your users should be made aware that if this alert button is red, to come in here and click on it to look and see what the note says or what the alert says. I'll put an alert in here, and we'll add a couple in there. So the alert comes in here, and then here's the note. So you can put those types of information in here. So if they wear contacts, if they wear, and it wants to know what kind, how many years have they been wearing them, if they're a contact lens wearer, again, what kind. And what their dominant eye is. So this has a summary of the information of of the meds, the allergies, their ocular history. And again, once we actually do any of these items, the date's going to show up in here. So at this point, if you want the technician to sign off on the page that they've reviewed it, then you can have the technician sign off on it and put the date and time stamp. And notice how it changed the red X, or the red box with the white X, to a little check mark. Then the technician goes on to the CCHPI, so I'm just clicking on this tab. So the technician would then come in here and indicate, if it's a newer and established patient, what the exam type is. So we have a list of items here that you can choose from. You can do a consult, the reason for the consult. There's also a historian. That depends on if the practice wants them to capture that information. Was it the patient themselves that is giving the information, or do they have a family member with them, or maybe a caregiver with them? That's going to be up to you if you want them to put that information in. It's not a required field. The insurance would pull in if we'd had an insurance on this patient. And notice how from the health maintenance, these important items do show up in here as well. Chief complaint. This is where you can click on the first field and it's going to give you a list of the common complaints that are listed here. For example, I'm sorry, say again?
You click on the arrow there?
Yeah, I just clicked on the field right here.
On the field, okay.
Yeah, I just click in the field and there's a trigger that automatically launches this. So let's say they're having blurry vision, it's going to actually walk you down these fields.
Okay.
So let's say they're having blurry vision in both eyes. And when did it start? Let's say it started 2 weeks ago. And it's been kind of progressive. And let's say that this eye is worse than the other. And it's constant. And it's when
all the time?
Yeah, where's our all the time?
Next up a bit up.
Oh, there it is. Okay, all the time. Thank you. And maybe it's inhibiting their ability to perform their job.
Yes.
And it's also causing headaches. And daily activity and chores. So you'll want to look at some of these lists to see if there are items that are not in here. This is also a pick list change that we can walk you through. So if there's something that pertains to the patient and is not in the list, you can actually pick the blank and free type it. So I can free type it here. Now, if one of these does not pertain to the patient, you don't have to fill it all in.
Okay.
They're just going to fill in what applies to that patient. And then if they change their mind and tell you something else, you could always come back in and fix that. And then this note button will actually come in and document that information.
Okay.
So it creates a little note. So if you need to make a change, and so I'm going to put intermittent here. What I would do is I would clear this box, and then I would click the note again, and now it will put that it was intermittent.
Okay.
So the symptom is intermittent.
Okay.
If you click this clear, it clears all these out. So you want to click this one, fix that, and then hit the note again to pull the data back in. There is also a place where if the patient denies something that happened, you can actually come in here and say the patient denies that they have flashers and floaters. And that adds it to the note down here. And then if they were previously treated for something, then you can come in here and document that they were previously treated for this condition. When? And for what? So you also want to look at this list as well. And by whom?
Okay.
So you can also document that information as well. So you can document up to 3 chief complaints. If there's more, then you can actually add it to the comments. So these are the 3 primary reasons. And if you come in here and the patient provides you with a second reason, let's say that they had the foreign body sensation in the right eye, and that occurred 2 days ago, and I'm just going to close out of that. And this becomes your primary complaint. This becomes your secondary complaint. This 1 to 2 will let you swap those without having to redo it.
Okay.
And then I can swap those back. So rather than having to clear it out and redo it, that allows you to do that. Alright, so once the technician has documented the chief complaints on the patient, then you can click this Review of Systems button, and that is if you want them taking the Review of Systems. That actually just drops us down to the bottom. That's right below where the chief complaints are. Just so you see where that took us. Some practices like to come in and select the ophthalmology global normal. Some like to come into the Add button so they can see what gets selected and select the global normal ophthalmology settings, and that's going to show you what gets selected for an ophthalmic review of systems. Then if there are additional items that are positive, then you can actually come in here and document those as well. So we have our respiratory, HENT. So if they did have possibly sinus problems, you could also document that here. And this little hyperlink here actually takes you even deeper into each one of the systems, to where if you wanted to document even more, here's the eyes. If they did have a dry eye and the foreign body sensation, that you could come in and document those items in here as well. And then we do the save and close. And so we have a little bit more than what you see here. So when I click on the OK, it's going to populate in here what we selected as positive for the eyes. And some do all others negative, but if you want to just get the basic coding points for the review of systems for an ophthalmology exam, that's why a lot of people will use that one that was the default normals for that for ophthalmology. Now, if you determine at this point you want a progress note, there is a progress note that can be generated here. But let's go on and go through the rest of the templates that the technician actually does. And I thought there was a page up button here. There it is. So I'm going to page up to back to the top. So once the technician finishes with this, if you want the technician to sign off, again, they can click here to show the amount of time that they were documenting in here and signed off on the data. So if you have different technicians working with the patient and you want to know which one actually did what part of it, that's what the sign-off is. So any questions on this particular template?
No.
Okay. All right, so I'm going to click on the history now.
Okay.
So I'm just walking across this bottom row here. This is typically what the technician is going to do.
The home, the CCH, the history.
All right, so we're now on the history. This is where the technician will document the medications that the patient are on. Ocular medications, systemic medications, the only difference in what you see in these two grids is that if we check the prescribed elsewhere button, and that's where it will filter them down into the systemic grid. So if I double click in the row right here underneath the column header, it's actually going to open up the medication module. If I can close that out. So on this patient, if you want your technician to add medications in here, we're going to click on this little medication search button. That's going to open up the window where we can come in here and type in medications that the patient is taking. For example, if the patient tells you they're taking aspirin, I'm going to put in the generic aspirin. So I can double click and add that to the patient. I'm just going to put a quantity of 1 in there. But what if we can actually put in the 30? And if they started taking this, let's say back in January, we can actually come in here and adjust the start date to when they started taking that medication. And then we hit the accept button, and that takes it from a temporary state to an active state. So there's pediatric, because we're on a pediatric patient, there's a precaution in here that we would acknowledge, and that becomes an active medication in here. So we can come in here and put whatever medications they're on. There are the herbals in here. St. John's wort is in here. The ginkgo biloba is in here. Your vitamins are in here also. So if they're taking vitamins, there's a SIG that we can add in here. Most of them will come with a SIG. But some of the vitamins won't. Now, if this was prescribed by a different doctor, there is a prescribed elsewhere, and it automatically removes the start date because we won't need that.
Okay.
If the patient tells your technicians that they're taking a medication and they're not sure what the dosage is, it's recommended that you pick the lowest dosage.
Okay.
And then when it's down here, I can click on the actual dosage, and there's an unknown strength. Now, watch what happens when I pick this. Right now, when I pick the unknown dosage, it's automatically going to select that prescribed elsewhere for me. And it gets rid of the start date for us. And the reason why we recommend that you pick the lowest dosage and say unknown dosage is so that when you add the medication on here, you're still going to get the interactions between a drug to drug or a drug to an allergy. So when I hit the accept, it's going to make it an active med. There's another precaution in here. I know we're on a pediatric patient, but we're just using this as an example. So notice how there's no dosage there because we said unknown dosage. But at least we have the medication on there so that when you are going to prescribe something, you'll be able to see at least that they're taking that medication. So let's also say that the patient was taking amoxicillin. And let's say that it was a, let's try this one. And let's say that the patient is no longer taking it. So we can come in here, and I'm going to have to put one in here. I'm just going to put this take as directed also. You may have a, they may have been given instructions on that. But let's say that they're no longer taking it, then all I have to do is click in here to put a stop date on it. And that makes it inactive, but at least we know that the patient was taking that medication at one point.
Okay.
So it's kind of like when you have the medications in the chart and they're no longer taking them, you put a line through it, you don't remove it from the chart, so at least we see that they were taking the amoxicillin at one time, but now it's been stopped.
Okay. See you next.
And if it were prescribed elsewhere, let me go ahead and I'm going to fix this too. If this were prescribed by someone else, it would get rid of the start date, and then you put the stop on there, and when we hit the accept, it doesn't show a start date because we know that it was stopped in here. And you can actually, on a medication, put a note. There is a general note, a patient level, a prescribed level, and a stop level. So if the patient stopped taking it just because they're no longer you can actually put the reason why. You can put if they stopped taking it because it was causing a reaction, you know, maybe GI upset or something like that, GI problems. If there were anything that you wanted to indicate, maybe they stopped taking it because it's no longer on formulary. Maybe it was an eye drop that caused irritation. A lot of physicians now are wanting to see why they're no longer taking the medication. Also in the module here, the patient conditions view will show you any current diagnoses and any current allergies that the patient has. And we can also take this little push pin and do the auto hide, so that filters back over here so that you can see any diagnoses and any allergies that the patient has right here in the module without you having to close out of it. Now, in order to see that note appear in the grid preferences for all of your users, you'll want to make sure that you come in and click on grid preferences, and then you're going to come to the set columns to display, and we want to make sure that we move this field called last audit over from the left to the right, so I'm clicking on the add button, and also the note field, I'm going to click on here and then click on the add button to move it from the left to the right. I'm also going to highlight both of those, so I clicked on this one, I held my shift key, I clicked the note field, and I'm going to move these up. And then I'm going to click the OK here so that I can see the last audit field And when I accept this, it's going to show me the note, so I know that this is inactive, and I can see the reason why. So if it was not on formulary, I would be able to see that. Or if I wanted to hover over the note field to see why, which is up here, any of the notes that are on this particular medication. Because it's only going to show the most current one there. So if I add another one, it's only going to show the latest one. Close out of there. The reason I activated this last audit field, the last audit field will show you the indicator. If you print it, it'll show the P for print, the F as in Frank for fax, and it'll show the E for the e-prescribing.
What is that?
So that'll show that here.
Okay.
So if we actually printed this, and can I go ahead and print that to this?
Yes. Yeah.
Okay. So I'm going to show you. See how it brings up the P?
Yes.
So it'll show you it was printed if I hover over it. If I highlight it, the dispense history down here actually shows me which user did it and to what printer. So if we faxed it, it would show an F, it would show the audit date and timestamp, it would show the destination to the pharmacy where it was faxed, and it would also show a status of whether it was sent, if it failed, or if it was pending, if it was in the process of being sent. And it'll do the same thing for your e-prescribing. It'll show you what pharmacy it was e-prescribed to. It will show the date and timestamp and the status as well for that. So that's why on each of your users, you'll want to activate that last audit field so you'll be able to see that here. Now, I could also right-click to get my dispense history as well if I wanted to. But wanted to show you initially, if you highlight it, it's down here, but you can also right-click to get the dispense history as well. So that's how your technician up here can document medications that the patient is currently on. When you print them and you are going to prescribe them, you'll be actually using, and see how this shows up in here. Here's the active med. Here are the ones that are prescribed elsewhere.
Okay.
All right? Now, when you prescribe as a physician, you're going to use the prescribe new button, but it's actually the same place.
Okay.
We can also create favorites for you when you get ready to prescribe. And we'll come back to that in just a little bit because we're going to finish up what the technician does. So when the technician is finished with the medications, then there is the reconcile for meaningful use, that you can come in and the technician can see the active meds, or they can also include the prescribed elsewhere. And in here is where you select the medication and can indicate if they are currently still using it. Let's say the patient states they're compliant, and I'm going to save that. The vitamin B, let's say there's an occasional omission. And the Ecotrin that they're taking, they are compliant. And what this does is keep a timestamp or information in here for meaningful use that this user has reviewed the medications with the patient, and you can include the medication reconciliation information in your chart note. The user can also at this point come in, and if you have a pharmacy for the patient, you can also add the default pharmacy for the patient in here as well. You can also click on the meds reviewed to indicate that they were reviewed. Depends on if you want your meaningful use, you can get it either way. So if I come down here to the systemic and I double click in here, notice it brings me to the same medication area. So it doesn't matter which one you pick to document it in, it's going to put it in the same place, just the filter prescribed elsewhere drops them down here. Alright, the technician would then go on to review the allergy. Also notice over here, if they're taking unknown cardiac, high blood pressure, diabetic, cholesterol, and any other unknown meds, they can just come in and click this so it lets you know that they're taking those kind of medications if they don't remember the name of it.
Okay.
And there's also a place here where you can free type if it's something else other than those. And that will also display on the chart note. Alright, so allergies, any allergies that the patient has, they can double click in this row to open up the allergy module. In the allergy module, here is the little search button. And let's say that the patient was allergic to egg. So it's automatically going to browse out there for me. And so starts with shows anything that begins with egg. Contains will give me a little bit wider search window here. So the contain says show me these characters, whether they're at the beginning, in the middle, or at the end of the descriptor. So see, this one has EGG in the middle. So I'm going to say they're allergic to the base ingredient of egg. And we've added the intolerance and a severity level because some practices were saying that it's not a true allergy, but an intolerance. And then I can add the reason or the reaction. See, there's nausea and vomiting. We'll pick that one. I have to click the add button to actually add it to the patient. So you can come in here and search for a number of different allergies. And then here's the specific allergen group for the sulfa for the sulfonamides. So once they appear up here, then we can click the review button. The review button will show that this information was reviewed by the user. And again, for meaningful use, it shows the date and time stamp in which user actually reviewed the information with the patient. You can also say that there were new allergies added this encounter, or that allergies were reviewed, no changes. So you have a couple of ways to get to enter the data in here.
Okay, I'm so sorry.
Any questions about the allergies?
No.
Okay. Am I going too fast, or is that okay?
No, that's okay.
It's good? Okay. If I go too fast, please let me know. All right, past ocular history. Again, I'm going to click in this row. I'm going to double click with my left mouse button to open it up. You have to pick one of the radio buttons for the systems in order to get the disease list to filter based on which one I selected. Which eye?
Right eye, OD.
Oh, OD, sorry.
Okay, both eyes.
That's right. Either way, maybe this one was done back in 1999. If there was a procedure, then this is where it shows the procedures. If there wasn't one done, and then we'll show you how to add to the list of surgeons in here. And we'll also show you how to add to the location list. And then there's also a pick list for the outcomes. So if that's all we need to add in there, I'm going to hit the Save button, which keeps me in here. I'm going to hit the Clear for Add. Again, I'm staying in the window, so I'm not having to open it back and forth. And then if I wanted to come in here and select retina vitreous, then now it's going to give me let's say this one was in 2005. And again, if there wasn't a procedure, but there are procedures in here.
Okay.
If we need to add to these lists, because there's some procedures that are not in here, we can show you how to add to that. And I'm just going to do the Save. And now I'm going to hit the Close, because I'm not going to add another one. But it's going to add to that information here.
Okay.
Now, this information that we've added here in these grids so far are what we call, they're going to be a summary, so when the patient comes back in again the next time, this data will be already in there, and the technician will just review the data with the patient again. All right. Now, notice that in these next three sections, in the past systemic, there's 4 radio buttons. In family history, there's 4 radio buttons. And in the social history, there are the same 4 radio buttons. In order to get appropriate credit for your coding, at the end of the encounter, you do need to pick one of these. The detailed will show all the details. The reviewed no changes, that's all it's going to say is reviewed no changes. And the reviewed updated will say reviewed updated, but shows all the information. So in this one, I'm going to do detail. I'm going to double click in the row to open this up. Same concept, we have to pick a category first to get our list. Because if I come in here now, it's not going to launch anything until I come in here and select the radio button. And then I come back and click in that field and it'll show me the list. So this is where you can add, and again, we can add to these lists if there's something that's in here that, or not in here that you need. So same concept, Save. Clear for Add keeps me in here. So I can come in here to document if the patient had diabetes, I go to the metabolic endocrine. And when I go to the disease, this is where it breaks it out.
Diabetes up there.
And if they're not sure of the year, you don't have to put it in.
Okay.
So these are not required that you have to put a year. We used to have a date where it asked you to put in a specific date, but how many people actually know the exact date when they had some sort of a disease? Most people don't. So you want to look through these to see what's under each of these lists, where you can add this information. So they have hay fever. I'm going to do Save. I'm going to click Close. And so now we have those items. Now, if you need to go back and change one of these, I can double click on that to open it back up. And then I can change and add anything to that same row. Family history allows you to document whether or not they have a history of or no history of. So I'm going to go to the no history of, and I'm going to click in the little diagnosis, and let's say they have no history of macular degeneration. And then I'm going to hit this little blue add button. Let's also say that possibly the grandfather, the paternal grandfather, had cataracts or glaucoma.
Okay.
And we want to do history of. And then I'm going to add. So it's going to now say the paternal grandfather had glaucoma.
Okay.
So pick from this list and say multiple family members might have had glaucoma and add. So it just depends on how you want to filter that.
Okay.
All right? So we could say reviewed, updated, so it just depends on how you want to do that. All right, social history. And because we're adding all new stuff, we're doing the details. Social history, whether or not the patient smokes or not. If you say yes, it's going to ask you the amount and the number of years. If they drink alcohol, the amount and the frequency. Caffeine, if they drink caffeine, how much per day. And if there's any drug abuse or not, we're going to say no to this one. But if you say yes, again, it wants to know what kind. So this is where you can fill in the information regarding that. Now, there's also another little checkbox down here that if you do want to document the blood sugar for the patient, that it will keep track of that in here, and you can indicate, was this reported by the patient or was it reported by the physician? So I'm going to close that out. We didn't make any changes. I'm going to uncheck that so it clears it out. And again, if we wanted to do a progress note from here, we could do that. So I'm going to go ahead and page up. Once the technician finishes with this area, then they can again click the check off or the sign off here to show that they have finished reviewing this information. Because what if one tech left and another tech came in to finish the history, then whichever tech did it would come in and document the information. Any questions about this particular template?
No.
Okay. So I am then going to go on and click the tech exam.
And I will ask a question.
All right?
Yeah.
On the tech exam, if you have interfaces to pull in data like into the manifest or the auto refraction, that would be done on the pre-screening template, where this gets activated so that when you click on the there'll be little buttons on here, so when you click on it, it will automatically drop the data or pull it in from the interface into these areas.
That is the previous
But you have to,
the previous exam?
no, this is if you have an interface
Okay.
to pull the data from, like your lensometer or your autoreflector.
Right. Okay.
That's where the data is going to populate in here. All right, so I'm going to go back to the home for a second, and we'll go back to the tech exam. If you manually enter data, here's where you can pick the type, and where you can come in and put in your readings in here.
That's it. All right.
And I'm just going to put in a couple of items in there.
Thank you.
Let's put a -1. And if you need a negative, you click on the blank and it gives you the negative. Manifest refraction is in here. Auto refraction is over here.
Okay.
So same concept. If you do it manually, you pick the items in here.
So if you click on the X, it changes to minus or plus.
Yes, it starts out here with the minus, but if you pick the blank, it takes it to the plus.
Okay.
And same thing here. If it's the plus and you click the blank, it takes it to the minus. And I'll just go ahead, I'm just going to put some information in here just to have something in there. All right, now, visual acuity is down here. The chemistry is also here.
It's here, I can see that.
So visual acuity.
The one on Chechanya, that's what you usually come to see.
Okay.
We have it there. Do -1. And then here's the OU. Here's your pinhole.
Pinhole, yes.
Here's your near vision.
Yeah, vision, yes.
And when I click the save button, it's actually going to drop it here into the list.
Okay.
260.
So I'm going to scroll down just a little bit here.
68.
Next thing is going to be your IOP method. If you don't do some of these, we can actually filter them out. Most do at least the applanation or the Tanapen, and then you can indicate what the reading is in here. So once you put the applanation in, then you're going to click on the save button to add it to the grid. So it's going to pick up the actual date based on our encounter date. So I'm going to go down a little bit further.
Which extension is?
When your technician comes in, you'll also want to have them, rather than picking every item in here, because there's lists in here, we have a default within normal limits. So with one click, you're getting your values in here.
Okay.
All right? If you need to change it, you can come in here and pick something.
Good morning.
Okay.
And if you want to do it on both sides, it'll filter over to both sides.
So the filter, the default gives the normal.
Right. The default gives you normal. But you can also, your technician can come in here and also
Change it.
document, change it in here.
Any blank space you click, then you can change it.
You can free type it, right. But if you find something that you're free typing a lot over and over again, we can help you add it to this list so that you can choose from it. Now, one of the things that several clients have asked is, can I put the ones that I do the most up at the top? That's what these are. So if you want to move more up here, we can move others up here that you do the most so that you don't have to look through the list. But if I wanted something down a little further, I can actually type a character and it'll drop me down and I get information above it. So if I wanted one of the ones for limited, I'm going to type an L, or I can type an LIM and it'll drop me down and I can see here's the M's and I see everything above it.
Okay.
Whichever is easier for you to use, or if we want to move the ones you frequently use to the top, we
We
can.
can type in from the board.
Yes, and you can also pick the blank and you can free type.
Okay. All right. That's it.
So we give you like 3 or 4 options with that. Your dim measurement in here takes you to the left side so you can do the other one, and then the bright moves you from one side to the other also.
I'm trying to get someone
Here are your modifiers. So you see what's in those lists. And then here are your angles.
Okay.
And then when we get down to the dilation drops that are used, again, a lot of practices don't use all of these. And if there's one in here that you use that's not in the list, we can again show you how to add to this pick list. And then we can filter out the ones and again move them up into whatever order you want them to be in. I'll just pick one.
Yes, go on.
And say again?
Go on.
Oh, okay. So, and then you can indicate who the history was recorded by and any other comments. And again, you can free type in any of the comments. There's also down at the bottom here a tech report that can be generated to show what the technician added into the system.
Okay, that's the ones you added.
Uh-huh.
Okay.
So it shows who the patient is. And of course we'll remove this from the footer. We'll remove the NextGen logo from the top. But this gives you all the information that was entered by the technician. Don't have to print it out, but you can generate it and have it on the encounter. Now, would it be you drawing, or would it be the technician that's doing the drawing?
The drawing will be done by the doctor himself.
Okay. All right. So I'm going to go on to the testing tab, because this will be the next tab that the technician goes into. And then we'll switch over and we'll go into the doctor view. So here's where the technician could come in and do the Amsler grid. Here's the Ishihara, Farnsworth. Here's where the picometry is. You can put in your readings for the picometry.
Very good.
Okay, did you want permission to drive?
No, the readings for the picometry.
Okay. So what do we want to do for the picometry in here?
Let's say 565. Right, and 5.
I'm sorry, what was the last one?
575 left. 575 left.
Okay, do you
Okay.
have our fax number, sir?
Okay, I can see it. All right.
Okay,
Okay.
that's 8083.
So it gives you an average. And then your glare test is down here.
Yes, I can see that.
And then the potential acuity meter. Here's where your other tests are down here for the visual field.
8083. Oh, all right. Okay.
So you could also wait and do the tech report down here as well.
Let's do the visual field template and see.
Okay.
You click on the visual field, what do you see?
Okay, do you want, we'll do the test or the professional. So that's all it's going to do is indicate that it was done.
The test. Oh, it just indicates it was done. Okay. Aha.
And then we task to the user to do it. So it's just an indicator of the ones that have been done.
Okay.
Okay? And then this is where if you want to wait to do the tech report after the other tests, and again, the reason why they have it on both templates is it just depends on what you have the technicians do. Some of the physicians are different in what they have their technicians do.
Okay.
So there's the exam. Let me see if I can get back up here. Or if they forgot to do it on the other one, they can still do it on the other test. So here's where it shows the glare test, IOP, the chemistry.
Okay.
So that's the report that gets pulled in.
So the physician can actually pull this out once he's doing his own. Right?
I'm sorry, say again?
I said the ophthalmologist can pull this out.
Yes, the ophthalmologist can come back to this also. Notice how it's storing the templates or forms that we've been working on. That's what these little icons are, the little templates.
Okay.
The documents is going to be this little tech report that we did, and then at the end there will be the chart note.
Okay.
We added a medication, and we added an allergy, so that's what these little icons are.
Okay.
And when we get to the drawing, it'll show an image icon here. So this is showing on that encounter all the items that we've touched so far.
Okay.
All right, so I'm going to filter that back out. All right, so I'm going to page up, and then we're going to have the technician sign off on that. So at this point, the technician would then go to the tracking and come in here and say that the patient is with the provider.
Okay.
And they would save that, and then in the inbox it changes to show that the patient is now with provider.
Okay.
And when the provider goes in, the technician can come over here and leave it on the provider start. The technician would log out, and then the physician would log in. Because that way it's documenting the information. I'm sorry, what?
For that client, for that patient.
Yes, on this patient.
If
this is the same,
the technician pages, it logs out.
If you have workstations in the room, yes, you will want the technician to log out and the physician to log in. But if I log out, and the physician logs in, they're on the same patient in the same place.
Okay.
But you want to make sure that when the physician logs in that they're documenting on the same patient. Because every user is going to have their unique username, password, or PIN number to document on.
Okay.
And because you're going to have different permissions in the technician.
Okay.
So they'll log out, but they can leave you on the provider start, so when you log in on that same workstation, that you already have the patient up and you're just going to review the data in here.
Okay.
If you have a tablet, then you're going to log in on your tablet. Or if you have a laptop or something like that. Depends on what you're using.
Okay.
So, sorry, say again?
We're using the personal computer, yeah?
Okay. So, if you need to see this a little bit more in detail, there is this expand button.
Okay.
That you can see it if there's more than one chief complaint, and also you'd be able to see the chief complaints, a history of them in here. So each time the patient comes in, there's going to be another row in here of data based on the date that they came in.
Okay.
Does that make sense?
Yes.
Because that's a summary of the HPIs. And I'm going to click the return to bring me back.
Okay.
Any of the plans that we do are going to list in here also. This is going to be a summary of any of the impression and plans that have been done on this particular patient. This kind of captures the history.
Okay. Before we go to the provider, sorry I'm asking this question.
Sure.
When I log in, how will I get to this part? Because I didn't get it.
Right. We can set for you as a provider, if you want to start with this template, we
No.
can also...
I want to do the technicians one first, but I'm going to teach them.
Okay. So, I guess I didn't understand your question then.
The thing is that if I log into NextGen, what icons drive me to get to this clinical level?
This one right here?
No. To get into this sheet, where I provide the home, this sheet. How do I get to this sheet? You know what I mean?
Yes, sir. When you log in,
Yes.
and all you're doing is ophthalmology, right?
Yes.
Okay. On your user, if you're just doing ophthalmology, we can set this up that it starts you here at the provider start. We can find the provider start template and set it up, and we can say to open that template from the workflow appointment.
Okay. So when I open up, I go to the
What insurance do you have?
That's what I don't get. Hold on. Start again.
Okay, that's what I'm going to do. I'm going to find the template in here.
You want to put the technician first.
Give me a state of birth.
Well,
Put the technician on this, on the, here now.
all right. Well, first you said you wanted to come to this first, so that's why I'm trying to find out which one did you want to start with.
My difficulty is if I come in the morning as a technician, open up and sign into NextGen, how do I proceed to get here? That's what I'm saying, the procedure.
Right. You want to get to the provider start, correct?
To the technician, right.
Oh, to the technician? Go ahead and I'll put this on here. Where's the iMaster? I'm going to set this.
Yes, okay.
All right, so what will happen is when you as a provider come in, I'm going to go ahead and close out of the patient.
Yes.
When you as a provider come in on your workstation, you're going to right-click and go to chart here,
Okay.
and we can have it open to this.
Okay.
Or if you prefer, we can have it open to this one if you would rather.
The provider, okay, all right.
Yeah, it depends on which one you want to start at.
Okay.
Because here you're reviewing all the information that the technician put in. Here's your visual, here's your vision. Here's your best corrected. Here's your ocular history.
Okay, ma'am.
And if you want to expand on any of these, you can.
Yeah, okay, okay, go ahead.
So it just depends on which one you want to start with. If you're on the same workstation, they can leave it up on this one when you come in.
Okay.
It just depends on how you want to do that. So we can work with you to determine which template you want to start, if you want to do here or if you want to start here. It's up to you.
We'll start with home.
Okay? So to start at home,
References. Okay.
this is where you would put this in here.
Okay.
This open from workflow appointments, when you right-click and go to the patient's chart, will always bring you to the home page. This is the computer name. This is the display name. So see that home OPH? This is the real computer name, but they changed it to home OPH. So we can set this up so that when you go to the patient's chart, that it opens you on the home page.
Okay.
And then you can choose to go to the provider start from right here. You don't have to go across. You can just come to the provider start if you want.
Go to provider, yes.
Yeah.
Thank you for calling us.
Okay.
All right?
Okay.
All right, so is everybody doing okay? Do we need a quick break here, or is everybody okay?
Okay, let's have a quick break.
You want a quick break? Okay, you want to take, what, about 5 or 10 minutes, something like that?
5 minutes?
5 minutes? Okay.
Is that?
All right,
Okay.
that works. All right, I'll be right back.
Okay.
Okay, Dr. Cursor, don't hang up. Just leave the phone there. Okay.
Right, yeah, you can just put it on
yeah, put it
hold.
on mute. Just don't leave.
What is that?
Don't hang up the phone. Just leave it.
I'm not turning off. I'm not turning off.
Thank you.